everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about the skill of delegation. So let's get into it. Some key things you need to know. You should only delegate when the patient is stable, the task that you're asking them to do is within their scope of practice, you will be available, so you meaning the nurse, will be available to do all necessary teaching, and that you can monitor the results. Because you, the nurse, are ultimately responsible for everything you delegate. So if they do something incorrectly, right, or something goes wrong with your patient and you weren't aware of that, that's not their fault. That's on you because you are ultimately responsible. I wanted to point out who can delegate to whom. So a registered nurse can delegate tasks to an LPN and a CNA, and an LPN can delegate tasks to a CNA. Now let's talk about the 5 rights of delegation. Now let's talk about the 5 rights of delegation. These are the things you want to think about before delegating a task to somebody. And the first one is it the right task? So is this something that's in that person's scope of practice? Are they allowed to do it? So you do have to be a little familiar with the scope of practice of other people, and you also have to be familiar with the policies and procedures of the place that you work. So at one hospital, maybe they say, yes, LPNs with a certification certificate can start IVs. At another hospital, they say, no, only RNs can start IVs. So you need to know the differences. So right task, right situation. So the task you're asking them to do compared to the condition of the patient. So for example, you can normally ask, the CNA to do a blood pressure on your patient. But if your patient is unstable, right, they've had a change in condition, it would not be appropriate for you to delegate that task. That now has become your responsibility. So think about the condition of the patient. Is this the right person? So the person you're asking to do this task, do they know how to do it? Have they done it before? And if it's not an emergency situation, maybe this is a time you can actually do some education and you can teach your assistive personnel certain things that they're allowed to do within their scope of practice. But if they've not done it before and you don't have time to do that, you don't have time to watch them, maybe you shouldn't delegate it. Maybe you should just do it yourself. Are you giving the right directions, so the right instructions? You have to be very clear what you want them to do. And then you also have to be clear about, I need you to go take their blood pressure and I need you to come back here and tell me the results. So you got to make your instructions known and you got to make them very clear so that there's no opportunity for confusion. And then the final right is the right supervision. So you, again, ultimately responsible for everything you delegate, so you have to always follow up. So let's say it was the right person, the situation was good, the task was in their scope, they knew how to do it, and you gave very clear directions. You're not done yet, because you always got to follow up and make sure everything went according to plan. So those are the 5 rights of delegation. There are a couple more things I want to talk to you about. Specifically, what are some things you should never delegate? Now I wanted to talk about some things you should never delegate. And there's a cute little memory tool for this, and that's TAPE, so T-A-P-E. And that stands for teaching, so any patient education should never be delegated, that is your job. Assessments, planning, like your care planning for your patient, and then evaluation. And as an example, I said pain medication administration because it hits all 4 of these. So it hits assessment because you're doing a pain assessment. That's your responsibility as the nurse to do a pain assessment. You would never delegate that. So you do your pain assessment. They say, yes, I'm having pain. So you need to interpret that, evaluate that, and make a plan saying, you know what, I think I'm going to give you some pain medication. That's your responsibility, not somebody else's. Then you're actually going to give the medication and there's teaching involved with that. So this medication does this and it has the following side effects. And then finally, after you've given the medication, a half an hour to an hour later, you're going to go back and evaluate the effects of that medication. So it would be inappropriate of you to tell the CNA, hey, can you go check on Mr. Johnson? I gave him pain meds an hour ago. I want to make sure his pain went down. That's not within their scope of practice. That's not appropriate. So never delegate anything you tape. And this is really important, not only just, in real life when you're the nurse, but think about this when you're taking a test and you have test questions asking you about delegation. If it's a tape thing, if it's something like this, you can go, oh no, I shouldn't delegate that, that's not appropriate, and you'll know the right answer. So that was my video on delegation. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know, and if not, I'll see you on the next one.